This is Dr. Roger Knapp, pediatrician. Let's talk about strep throats and sore throats. It's a common problem in pediatrics. Generally when you have strep throat, you're going to have sore throat, obviously, fever, extreme body aches, just extreme tired, laying around, lethargy, and sometimes vomiting, sometimes stomach ache and headache. For some reason it tends to cause an upset stomach. In the situation there, of course, you're going to go see your physician and they may do a throat culture. Now, the throat culture is positive in about 90%, maybe as high as 95%, but can miss up to 10% of strep. And so the throat culture, you have to understand, is not super accurate. On the other side of the coin, people who are just normal, not having a sore throat, feeling fine, and we culture all the children in any school, we'll come out with about 5%, 1 in 20 children who carry the strep year-round in their throat, about one kid in every classroom. So the child may come in with no fever, a bit of a sore throat from allergy or some other reason, and the doctor will do a throat culture test and it comes out positive. Well, it was just in there, been in there all year, and had nothing to do with the sore throat. But the doctor sometimes may give antibiotics, but some of your friends may even say, oh, my kid had strep throat and no fever. That wasn't the cause of the sore throat. Strep throat, they generally have fever and feeling fairly ill. Yes, there's minor forms of strep, but those are going to go away without antibiotics. And we try not to overdo antibiotics these days. So when you have a sore throat and fever, the physician will do a test. It comes out positive. If they give antibiotics, generally strep is feeling better in a day or two pretty quick. And if you're 3 days into it and is still running fever with the antibiotics, then more than likely it's viral, and the strep throat germ was in there but was not causing the fever and sore throat. Maybe the child had a viral sore throat or infectious mono, some other cause of that sore throat, and in fact the strep was just a false positive test. Then the other side of the coin, though, is that the child comes in with 103 fevers, strep throat, and we do a test and it comes out negative, and it still could be strep. Sometimes they'll send it off for a bacterial culture and start antibiotics for a day or two pending the culture. But again, in the best labs of America, it's only 95% effective, and you still actually could have strep. But that few days of fever usually knocks it back down to where then the child's feeling better, and the doctor may end up stopping the antibiotic because the culture was negative, but at least a few days helped. You may want to consider finishing up the antibiotic either way, because it may be a falsely negative test for strep. So it's not as clear-cut as people think as far as the tests for strep and sore throats. It could be positive and falsely diagnosing strep when it's not, and vice versa. You could have strep throat in a negative test. It's rather confusing, and we still use our clinical judgment as to whether or not this might be strep. And then the test tries to help verify that. Hope I didn't confuse you. This is Dr. Roger Knapp. Thank you.